Good, good afternoon, everybody. Welcome to ReeLabs Saturday webinars. We are so glad to see so many familiar faces again this week. And welcome to the ones who are joining us for the first time. ReeLabs has been doing a series of informative webinars every Saturday, inviting experts from various fields to come and help us lead a healthier, better life. Today we have with us Dr. Vijaya Bopardikar, a well-renowned dentist with a very successful and respected practice in Juhu, Mumbai. Dr. Vijaya has 20 years of experience in the field of dentistry and specializes in restorative dentistry with special attention to children and restoring teeth with implants and build-ups for adults. Dr. Vijaya is also a mom to two beautiful children and an extremely compassionate and always smiling when she's dealing with her little ones on the chair. Thank you, Dr. Vijaya, for giving us your valuable time. Over to you.
Thank you so much, Saloni, for such a lovely introduction. It's my pleasure as well as my privilege to be able to speak for ReeLaboratories. And I do hope I do justice to this particular topic. So today my topic is about children, about mothers, the ones who are carrying to-be moms and the ones who are new moms, how they can manage their dental hygiene and their regimen. So should I start with my screen share?
Yes, doctor, please go ahead.
All right. As Saloni has already told you all about what I do and where I am practicing. I've been practicing actually since 20 years. And over the years, there are certain tips that I have learned and certain scientific things which work for to-be mamas as well as their little babies. So I'm here to share it with you, and I hope it is absolutely useful. Now, many of us wonder, why is pregnancy related with oral health? Is it really, I mean, does that really matter so much? I brush my teeth every day and that should be fine enough. But no, it's beyond that. You need to pay a little more attention to your teeth. And it's not only the ones who are already carrying, but mamas who are planning their pregnancy also need to have a little regimen in place so that they have a very smooth pregnancy and do not have to worry during that beautiful phase of their life. So the connection. In females, what happens is that when you have gum disease, okay, when gum disease is also called as, inflamed gums, gingivitis or periodontitis, it directly affects your immune system because your immune system goes into an overdrive. And that can reduce the amount of fertility. Your fertility rate, it can reduce. It also has an effect on men. So it's extremely important that you take care of your gums. Now, when we talk about our teeth, it's not just the teeth, we also talk about the gums and the bone. That together forms the periodontium. Any one of them, if it's unhealthy, it's definitely going to affect your oral health. So in women, because of so many kind of hormonal changes, it's the gums which get affected first. So after the gums are weak, then comes the cavities, the infections. So it's better to always go to the dentist, especially when you're planning your pregnancy, just to make sure that your health, oral health, is in good hands and it's well taken care of. Now, what happens when you have, when you're carrying, sometimes you feel I brushed my teeth twice in a day. Despite that, my gums are bleeding, or I'm just feeling too itchy in my gums. I feel like sticking something in my gums, or it's bleeding when I'm brushing. This is nothing to worry about. This is a pregnancy gingivitis that comes in. Usually it comes in the first or the second trimester, but many a times this can be even kept under control, like taking, small little tips like warm salt water gargles, going in for a regular cleanup, flossing your teeth, making sure you rinse your mouth after you eat your food, because these bleeding gums do happen because of hormonal changes. But if it gets worse and you don't take care of it, or you feel I will not touch my teeth, forget it, I don't want to brush my teeth because they are bleeding, you're going to get it into a worse condition because the plaque buildup will only worsen the situation. So all these things are not irreversible. They're all reversible only if they're taken care of at the right time. Of course, don't get scared looking at this particular picture. It's called pregnancy gum tumor. Basically, it's an inflamed gum in a certain area, usually happening in second trimester because of a plaque buildup, because of huge hormonal changes. They also settle down on their own, especially after birth. But if you feel there is a difficulty in eating, chewing, too much of bleeding, it's coming right in the way when I'm talking, the dentist can help you out with it. They can actually eliminate it or clean it and help you reduce the size. But all this you have to do under the supervision and the timing of the dentist. You cannot choose to go whenever you feel like it. They will tell you exactly when to come and how to get it done. So when you're pregnant, just to make sure that, you don't have to worry about your teeth now, because there's so many other things that you have to worry about. Just make sure that you brush your teeth twice, eat your meals on time, have a good regimen, have a balanced life, sleep well, eat well, drink well, rinse your mouth, use a fluoridated mouthwash. All these things will help you have good oral health and your entire pregnancy period and the period after that, because the first 3 months you're going to be very busy. You may not have time for yourself, are going to be smooth sailing. Now, there are a lot of mamas who are perfectly healthy, but because of the changes that happen in your body, they have gestational diabetes, preeclampsia, where you have increased in your heart rate, sometimes preterm labor, and low birth babies. Birth weight babies. For example, especially those who have got very bad oral hygiene, those who have too much of plaque buildup, those who have not taken care of themselves, especially, those teeth which need to get extracted, or those which need to get treated, or you've had an abscess and you're just dousing it with medicines, that's not going to help. So it's just going to worsen situations. Make sure that you get that attended to so you don't get into these kind of issues. And of course, if you do have this, make it a point that whichever doctor you visit, whether it is your gynac or it is your dentist or your regular physician, you do mention this to them, because they will take certain precautions when they are treating you. So of course, these are the healthy tips which I have just mentioned. I'll just reiterate it, that twice a day you need to brush your teeth gently. Your gums might feel soggy. Don't worry, continue brushing. Even if it means it's bleeding, just take half a glass of warm water with salt, swish it in your mouth. It'll take care of your teeth. Have a balanced diet. Of course, you will have certain cravings. You can have them, no problem. But at the end of it, you must have a healthy, balanced diet for everything, for your good epithelialization, not only for your oral health, but for your well-being. Now, you need to get your cleaning done. Many a times people wonder, I brush my teeth, I don't have any plaque buildup. Why do I need to go to the dentist even for a cleaning? I mean, I don't have any problems. Ideally, we are not getting younger. Physiologically, we're all aging. So every 6 months, you must visit your dentist for a cleanup. It's called as a prophylaxis scaling. They just clean the teeth, remove the extra debris, the plaque, the calculus, the tartar, and that just keeps you healthy. It's like servicing your mouth, which is very important. Those who don't floss, please learn how to floss. Ideally, you're supposed to floss your teeth every day. Even if you get away with 3 times in a week, it's good enough. Using a fluoridated mouthwash is good, especially during pregnancy. The reason is that many a times, we may get up and have morning sickness, and that really gets you. So of course, your gynac can give you certain medicines, which will be antiemetics, like, pregnedoxin or the kinds of that. But you may not want to even put a toothbrush into your mouth. So in such situations, you're not going to stop brushing. What you will do is use a small head toothbrush, okay? Quickly brush. Ideally, you're supposed to brush for 3 minutes. You don't need to do that. You can do it in around, say, 50 seconds. Okay, and you can finish your brushing if you use a small head, especially for those who have this gag reflex, those who have this morning sickness and they feel, oh my God, I'm just not feeling good at all. Even when you vomit, okay, many a times you feel, let me brush my teeth. Now, that is not advisable, because when you vomit, you have an acidic environment in your mouth. Use a normal tap water, rinse your mouth off. When you brush your teeth in an acidic environment, it actually worsens the enamel, right? So you rinse your mouth after you vomit, okay? Wait for about half an hour and then brush your teeth. These are small little tips which will help. Because the gums are soggy, there is more plaque buildup, okay? So flossing is important. And if you do develop small cavities, make sure that you get that attended to. Okay. Now, many a times, when you don't feel good in your mouth, you can chew gum, no problem, because gum also helps you in, stopping that gag reflex. You'll feel nauseous. You may just feel like having something in your mouth. That'll help you, but make sure you rinse after that, okay? Especially if those are not sugar-free. So very simple things. Now, of course, smoking is an absolute no-no. The moment a patient comes in and they open their mouth, we can make out whether they've been having good habits or not. So not only for your baby, but for your own self, even passive smoking is no good. Yeah. Now, many a times you feel that, I'm feeling acidic, but I want to have a little bit of warm water with honey and lemon in the morning. It's fine, but do not let it linger through the day, because you have to maintain a pH which is more alkaline rather than more acidic. So though lemon, when it goes into your stomach, it is neutralized, but when it's in your mouth, it's still acidic. So even I like, a warm honey lime water, but I don't let it linger on for about 20 minutes, 5 minutes, and I'm done with it, after which I rinse my mouth. The same thing applies for all you to-be mamas. Yeah, this is a small little tip which goes a long way. When should I visit the dentist? Now I'm already pregnant and now I have some dental issues. What do I do? So the first 3 months is the time when you have a lot of organogenesis, where, the organs, baby's forming, everything's happening. So try to avoid going to the dentist at that point, unless it's absolutely an emergency. Second trimester, which is 4th, 5th, 6th month, that is the safest time, because, you also build up an appetite. You feel good, you're energetic. So you're fine. You're okay with going to the dentist. Make sure you mention that you are carrying. Of course, the baby bump will be visible, but in some mamas, it's not. So make it a point, please, to mention, not at the end of the dental visit, but right in the beginning. It comes in your history. When they're asking you about your history, it's extremely important to tell them that you are carrying. And of course, they will use small little positions, they will change the position so that you don't feel bad, as you don't feel like throwing up. They will use certain precautions. For example, X-rays, we do not use for mothers who are carrying. And in an emergency where we may have to, where it's absolutely important, make sure that you have a lead apron on, right? All those extractions, cavities, abscesses, all those which have to be treated, please get them treated prior, or get them under control so that they can be treated after your delivery. But in an event where something like this has to happen or get treated, your dentist will take utmost care. So when they have to use a local anesthetic, it is perfectly safe. So long as they use lidocaine along, sometimes we don't use adrenaline because we do not want to precipitate anything like a contraction coming in. As it is, the patient is apprehensive when they come on the dental chair. But it is perfect. Listen to your dentist. It's perfectly fine. And they will not do anything where you are uncomfortable. And many a times the dentist will be talking to your gynac to make sure that the medicines that they are giving you are safe, right? Because different people, different medicines work well with different situations and different people. So simple procedures which are absolutely necessary, for example, a cleaning or sometimes just filling a cavity or so, are fine to do during your second trimester. Unnecessary things like whitening my teeth, bleaching, things like that, you do not need to do. Leave that for later. You've got a lot of time to get all those things done. Now, which are the medicines which you can actually give during pregnancy? Paracetamol is extremely safe. Of course, you cannot just keep popping the pills in. You don't need to. But you go by the dosage what the dentist has recommended and you'll be fine. In case you have an infection which needs to be looked at, which does happen, amoxicillin is a good choice of drug. In case you're allergic to that, then a few cephalosporins can be used. Of course, go completely by the prescription of the dentist, because they will check your body weight, talk to your gynac and decide how much they need to give you, because they would want to give you a minimum dose. All right. There are some medicines, antacids and all those kind of things you can take. Of course, your gynac will give you a whole load of medicines which are good for you. Now, there are some medicines which you have to completely avoid. Okay. Some are teratogenic, which means that if it has an effect on the child, the growth of the child, even over the different organs which are being developed. Okay, so there are certain medicines like tetracyclines, erythromycins, chlorophenicols. These are absolutely a no-no. Yeah, so the dentist, if they tell you, please don't use this medicine, and somebody else tells you, oh, I was fine with it, please just go by what your dentist says. All right. Sedatives. Now, some mothers are very hyper. They want something to calm them down. Chamomile tea is good for you. No need of any extra sedatives unless prescribed by your gynec. A sedative is absolutely a no-no, not really required at this particular phase. And all those party drugs, you know that you're not supposed to take those. Yeah. Nitrous oxide. Now, a lot of my to-be moms, they feel, oh, you know, that laughing gas that you have, I would rather have that because that'll calm me down. But unfortunately, during your pregnancy, that is a no-no. Yes, after you finish your delivery, you want to come in, you can use it. Even little toddlers can use it. That's perfectly fine. You will be in a very good space. But during this phase, nitrous oxide is a no-no. Sometimes you have oral infection, fungal infections which come in, usually a topical antifungal or a mouthwash like Nystatin or so, or any kind of a tantrum oral mouth rinse is used for if you have a fungal or you have some kind of a white deposit on your tongue or your mucosa, some part of your mouth, because your immune system has come down, the dentist will give you whatever is required. If you need to take something which is oral, it will be only with the recommendation of your gynec. So antifungals, please don't pop them in on your own, thinking that I've done that before, it's very safe. No, it's not. It's not. Some medicines like diclofenacs, ibuprofens, which are painkillers, we avoid as much as possible. If we do have to give it, then of course we talk to your gynec for that. Certain medicines that I would like to tell you about are tetracyclines and erythromycins. These are the ones which I use quite often, when you go to a dental visit, and in case you need that particular drug, but we avoid it because these are teratogenic, which means that they affect the formation even of the teeth and the growth of the bones. So I'll show you a picture. Now, if you look at this particular image, the teeth look like they've got this orange band on them, grayish orange band. Nothing wrong with the teeth, but this is an intrinsic stain which is there on the teeth and it's permanent. No amount of whitening or bleaching is going to change this. And this is not the child's fault. The mom, unfortunately, was given a particular medicine which has had an effect on the growth of the teeth. So these are stains which will not go unless you do some cosmetic procedure on them. So best to avoid it. Now, this patient is lucky that there is no malformation. You don't have any, deformed teeth, because there are some medicines which can even arise to that. Okay, now I'm sure a lot of you moms who are, carrying will not identify with this. They'll wonder what happened. I really wanted this beautiful baby, and why are the mamas looking like this? But those moms who have just delivered and who have been into, taking care of their kids, they know, they can identify with this picture. So basically, after you deliver, you do not have time for yourself. Everything is rotated around the baby. And if it's your first baby, everything is confusing. You do not know what to do. And sometimes you end up neglecting your own health, and you end up eating, you binge eat, you don't eat. There's so many things. You're constantly eating, you're just popping in things, you're not worried about your diet. So a lot of things which you have to worry about. So now let's look at oral health postpartum. Post-delivery, as you see, mothers neglect their health. Some of them put on a lot of weight and they're unhappy about it, but they still eat free sugars, and that goes on, They don't have any fixed timing for food, so that affects the sleep patterns. They get lethargic. So try to have a good timetable to your life. I'm sure it's very difficult, but at least be a little aware about what you're putting in your mouth. And when it comes to a dentist, you'll be the best friend of the dentist if you brush twice and if you rinse your mouth after every meal. And don't just binge on the food. Make sure that you have 5 healthy meals in a day. Do not just keep snacking through the day. Yeah, whenever I get the time, I'm just going to have something. Even if you have, say, a cup of milk or something like that, make sure you drink water after that. Like So that's free sugars are absolutely a no-no. You don't need it. In fact, you want to shed weight. You're losing a lot of weight when you're nursing. So that's a good thing for you. Now, the most important point is nursing, teething, and brushing. I'm sure all new moms, now the baby's out. Now, what do I do with this baby? And how do I take care of the baby's teeth? So if you look at this picture, there is a silicone finger brush, which is being used in the baby's mouth to clean the gum pads and also the new teeth which erupt. So there are some children who are born with neonatal teeth. That means one tooth is already there or two teeth are already in the mouth. Very difficult for the mamas, especially when they're nursing. But there are some who very nicely, by 6 months to 1 year is when the teeth start erupting. And by the time they're 2 years of age, they have the entire milk teeth, the primary teeth dentition. And how do I take care of it? So it's very important to incorporate a nice oral hygiene regimen so the child looks forward to it and thinks of it as something, that he can play around. It's playtime for me. Also, if you see, this mama is holding a pacifier. It's not so common in our country here, but anytime after 1 month, you can use a pacifier. It also helps in the development of the jaw, the palate, as well as the musculature. But make sure that the pacifier is not just used only to pacify the child all the time. Okay, it's not something like that, and it has to be clean. So sterilization is extremely important. Second thing is, pacifier cannot go on forever. So by 1 year of age, I recommend that the pacifiers are out. But however, if it is, it has to go on. Maximum, it'll be 1.5 years. After that, you need to make sure the baby does not depend on the pacifier at all. And don't ever dip that pacifier in sugar or honey just to, douse, make sure that the child is comfortable. Please, no free sugars, no added sugars, and no hidden sugars for the children, right? All right, so now let's go to the next. This has got stuck here. No, just give me a second. No, it's not moving. Go back to escape. Computer. Just give me a second, guys. Yeah, okay. Why doesn't this move? I'll go by this. All right, now what to expect when you're teething? Now, do you see that little circle in that area and the gum pads? Those are the teeth which are erupting. So when the child is teething, they have a lot of, they are very irritated in certain times because they just feel like chewing on things. So give them things to chew. Now, what am I going to give them to chew? Things like cool carrot, which is cleaned, cucumber are the best things to give. Of course, you need to have an adult over there for supervision. But in case you want to give a teether, then you can give teethers which are washed well. Sometimes keep it in the fridge, with the ones with the gel, and let them chew on it. But make sure you're around, because just in case one squirts out, there should not be an issue with that. All right. Now here you will see that the same teeth have nicely come out. And once these teeth are out is when you really have to take care. Now, do I have to keep those gum pads clean? Yes, you do. Because many a times you can't brush them, or maybe you can use the finger brush, but you need to massage them with, when you use gauze, and then dip them in boiled water, which is cool, and just wipe it out. Even the process of them chewing onto that silicone finger brush is a process of massaging their gums. So that also will do the trick. But once the teeth are out, the finger brush is important. You need not use a toothpaste at that time if the child doesn't like the taste. If you have to use a toothpaste, use only the size of a rice grain. You do not need anything more. And all of these toothpastes have to be non-fluoridated. Yeah. Now, of course, this is a mother's nightmare. If you have a look at this, there are some children who do present with a situation like this, not the child's fault. Now, also, many a times no parent would want this for the child, but it is ignorance when they do not realize why something like this has happened. This is called as nursing bottle decay, where The child has got his teeth nursed all the way till 2 years of age and fallen asleep with that milk in their mouth. Or they've been using the bottle constantly. And after that, even after burping, the child is not given water. You need to give little water so that it washes off that milk. And another thing, of course, there are two schools of thought. But if you go by what the dentist says, you need to nurse your child for about a year. After that, wean the child off because they are not really getting nutrition from your milk. It is more for comfort. And it's actually doing damage to the teeth without you realizing that. So though you will be developing a bonding, there are different ways of developing bonding with your child. It doesn't have to be only that the child has to be nursed and fall asleep. Yeah, so mamas, please do yourselves and your baby a favor. Please make sure that once the teeth are in, you throw off that bottle. And even if you're nursing, make sure that they drink water. When you're burping them, they have to drink water. They cannot sleep with milk in their mouth. And if the child is big enough, for example, when the child is about 1.5, or even sometimes when they have slightly better manual dexterity, give the brush, let them chew on the brush and clean their teeth. The last bit of cleaning you will do, because you have to take care of their teeth along with them trying to play around with their teeth. Yeah, they are not big enough to manage their teeth by themselves right up till the age of 10. Because even when they're 10, they're in a rush. They have all other issues. They don't pay attention to their teeth. So as a parent, this is very, very important, something that you need to do. Why is it that I can't go ahead? Just getting stuck. Okay, one second. All right, so your first dental checkup is when the first tooth erupts. We usually recommend that if by 2 years the child hasn't come to the dentist, it's high time that they do visit us. And the first visit is always a wonderful visit for the child. You never start treatment on the first visit. They come in, they play around, they talk to the doctor, so they have a level of comfort. Regular visits to the dentist are extremely important so that the child has confidence. They feel that I want to go to this uncle or this auntie. Yeah, never scare the child ki brush nahi kiya to mere ko dentist auntie ke paas lekar jana hai. The child will never want to sit on the chair, and then they will never be compliant. So automatically it is such a struggle for the child as well as for the parent. So the trust, it is extremely important that you develop a trust. So when the parent trusts the doctor, the child automatically trusts the doctor. So it's extremely important. Also, I've seen apprehensive child, apprehensive parent trying to tell the dentist what to do. So you all have to be on the same page. The dentist is going to play good cop as well as bad cop. So they'll be very nice as well as stern to get their work done. Keep a timetable for meals. You know, when I was having my first baby, when I had him, I just didn't know how to manage the meals. But of course, now my child is 18 years of age and we've figured it out. We used to offer him food so often. That's a complete no-no. All right, that just kills the appetite. You need to have timely meals. 5 meals for the child: breakfast, mid-morning snack, lunch, early evening snack, and then dinner. In between, please do not offer them anything. They could throw tantrums. Children are very smart. They'll try everything under the sun. So if it doesn't work with you, it'll work with grandparents. Everyone in the house has to be on the same page. Yeah, it's for their betterment, not only for their diet and their health, but also for their teeth. Encourage cleaning of the teeth, especially the ones at night. See, the thing is, the children will visit the restroom in the night. So automatically they can brush, which means even if it is at 2 o'clock in the night, doesn't matter, brush and then go to sleep. Very important, because after a while, the child themselves will not want to sleep without brushing. And there's another philosophy is that when the child is older, when they start play group or so, give them a bottle and say, finish this water by the time you come home. And then at home, have another bottle. Let them finish that water while you're around. So they at least are rinsing their mouth, drinking more water. Now, a little bit about this tells you all about the eruption patterns. If you all want, you all can take a snapshot of this. On the left is the primary dentition. On the right is the permanent dentition. Yeah, so if you see, we have much more teeth as we are growing older. So if I have all my primary teeth going to fall off, why do I have to take care of my adult teeth? Why do I have to take care of those teeth at all? Adult teeth are going to come in. The reason being is that these are precursors to your adult teeth. Right? So if my primary teeth or my milk teeth are not healthy, there is no way that my adult teeth are going to be healthy. There's definitely going to be a situation where I will have infection, very high caries index, very high plaque index, and that is going to affect my oral hygiene even when I'm older. So it's important to prevent any kind of issues when you're an older child, to have a good set when you're younger. So parenthood is not easy. It's a learning curve. So the child is also growing and the parent is also growing. So when everyone is in unison and when you are educated and are aware, it's so much easier for you as well as the child. So these are the same things like I have mentioned. I mean, no processed food as much as possible. But if you ask me, as a child grows older, there is a time where you will be giving processed food. Just make sure that they rinse well, they brush well after it. They have it in a rationed quantity. You can't just serve it anytime. And you can't completely avoid it also. So I'm sure as a parent, you will be able to manage the balance. Please make sure you make it a family regimen to visit your dentist every 6 months. Here at our clinic, we have families who come to us. They book an appointment on Saturday or in an evening where the entire family has come together for a dental appointment. That's wonderful. It's very nice doing things together. So now you all must have also heard about toddlers, and when they're eating and you're continuously brushing their teeth and worrying about them, you've heard about sealants, you've heard about fluoride. So our water in India has a lot of fluoride in it, but a topical fluoride is important for the dentist to apply. So you will not apply it yourself. It'll be the dentist who will apply, because you need to keep it for a particular period of time and do it only for that many number of turns. Okay. It is sodium fluoride, which actually strengthens the teeth. It combines with the hydroxyapatite and makes it fluorapatite, stronger and more resistant to decay. Now, dental sealants. Many times you have got molars, which have got very deep grooves. And now these grooves, what happens is food gets stuck in these areas. And how are you going to make sure? You can't continuously brush your teeth all the time. So the dentist actually advises sealants for certain primary teeth and all the first molars and second molars, which are the adult ones, so that it's easier for the child to keep their teeth clean. And this lasts, if it's done well, it'll last you right up into adulthood. Right. Now, when I say, I talk to parents and they say, I don't give any junk food. I'm just giving sandwiches and they're fine. But after the sandwich still has carbohydrates. You've not given them water where they've rinsed their mouth at least thrice. So these are a few things which mamas, you have to tweak and understand that food going into the mouth, once the food is done, make sure they rinse their mouth at least thrice. Okay. So I've reiterated this very, very often. This is the most common cause of all dental decay and all dental problems in children. Yeah. So when we are treating children, we first educate our parents, because parents don't realize what is going wrong. I mean, everybody means well for the child. And many a times in India, child and love is all shown to the child only by food. So it is very important to be on the same page. There are certain habits which a child has, which the parent doesn't realize, and that needs to be eliminated. So when you talk to the dentist, certain habits can be corrected by certain appliances or by certain exercises, which are recommended by the dentist. Or sometimes you do not have to worry so much about it. A child will eventually get out of that habit. Corrective therapy, if the dentist recommends, it is absolutely important that you follow. Don't postpone it, because in children, the teeth are small. So it is definitely going to go in and then start paining him or affect or break down the entire tooth, which you don't want. So eventually you don't want a loss of tooth, because then you will have crooked teeth, because teeth also erupt at a particular time. So teeth will not erupt faster because I've lost a tooth faster. So you do not want those kind of issues to happen. That's why regular visits to the dentist are very important. So milk teeth have the same issues like an adult teeth, because parents say, "Arey, itna chota hai, abhi root canal kyun karna hai?" Now, this is very important because the teeth are the same. They have the enamel, they have the dentine, and they have the pulp tissue. So if there is decay, there is going to be infection. It will go into a root canal. There will be issues. So this is a picture where, if you see, this is a baby tooth. It's got cavity. It was neglected, went in, touched the nerve, then got infected. Now that tooth, if we have to save it, either we do a root canal with a buildup, sometimes a crown over it, like a stainless steel crown, because we don't want the permanent tooth at the back, at the bottom, to get affected. If this stays and you feel, oh, my new permanent tooth is going to come, it is not going to be a healthy tooth which is in that tooth bud. it is going to be either having some kind of hypomineralization or some kind of an infection. You don't want a situation like that. Yeah, so please make sure that when it is in the incipient stage, that is in the early stage, it is treated at that time. Toothpaste, big dilemma for parents. Actually, it doesn't matter even if you don't use a toothpaste, because a toothpaste is only a foaming agent. It just makes the process of brushing more pleasurable. So if the child doesn't like, for example, some pregnant mamas do not like having a toothpaste in their mouth. Don't brush with the toothpaste. Do it without it. Use a mouthwash afterwards, after the brushing. Don't use it as a substitute after the brushing. So for children also, according to the American Dental Association, you can use a non-fluoridated toothpaste right up till the time they are 5. That means till the time they spit. They can gargle and they can spit. Okay. Many a times, after 2 years of age also, if we feel, the dentist feels that there is a very high caries index, the child is not able to maintain, they will recommend to the mother whether a particular fluoridated toothpaste has to be used and how it has to be used. Yeah, so following instructions is very important. There are different brands which are available. There are children who are teething, and at that time, parents wonder, oh, what am I going to do at that particular point? Please do not use all different kinds of concoctions in their mouth. Whatever works for you, use that. There are some homeopathic things which are available. I am not an authority to speak on that, but if it works for you, you can use it. But you have certain particular gels which have got chamomile in them. They are used to massage the gum pads. The child feels very satisfied, and that's soothing to the child. They want to teeth. They want to bite on things. They can bite on things, not a problem, especially things which are clean. Now, fluoride, we have lots, I've already dealt on this. There is a lot of fluoride which is there in our water, but this is the recommendation which is there given by the American Dental Association. Like I said, in India, there is no dearth, but certain areas have got a lot of fluoride in the water, like Rajasthan kind of areas where too much fluoride is also not good. It can cause a situation which is called as fluorosis, which is how it is. This is called mottling of teeth. So there is a change in the enamel pattern. The formation of the teeth look deformed. So the enamel formation is affected. This is a permanent feature, and you will have to build up on these particular teeth. But fortunately, in a city like Bombay, we do not have this issue. Habits. This is something which is very important. Thumb sucking, tongue thrusting, nail biting, lip biting, mouth breathing. These are lots of habits which, are affecting the children, especially the profile, the growth of their jaws, the development. They have to be attended to early. Many a times the dentist will tell you when they need to be attended to and how they need to be done. So when should I use braces for my children? Now, when you go regularly to the dentist, they will actually tell you where this is the growth pattern. According to this pattern, this is what we want to correct. Rather than waiting for something to go wrong and then correct it, an early intervention is always better. Many a times, few things that we use it for, that we incorporate braces for, is for crowding, spacing, habit-breaking appliances, make you help in the jaw development as well as the alignment of teeth. So going early to the dentist also has advantages. You have certain frenal attachments which are high, which cause spacing. Sometimes there's a tongue tie where the child is not able to speak better. So all these kind of things are detected by your dentist. So don't wait for too long. Don't wait, I will go when the child is 12 years of age. No. From 8 years till around 12, 15 years is an ideal time where the child is still growing and you're making use of their growth to redirect the alignment of the teeth and the development of their jaws. Yeah. Now, these are a few tips. Brush twice a day, clean between your teeth, floss, teach your children how to floss. You learn to floss first and then teach your children. Don't injure your gums in the process. Spit. Okay. Whenever you feel that you got something dirty in your mouth, just don't keep it in and swallow. Rinse your mouth more often. Limit your snacks, drink lots of water, and you will have super teeth. Don't worry. Now, since I have got a chance to speak for ReeLabs, I wanted to mention that dental stem cells also is of great importance, especially for those who have missed the bus with cord blood banking. Now, where do you find the dental stem cells? They are there in the pulp tissue. Pulp tissue is where you have the blood vessels and the nerves inside the tooth. Yeah. So you can procure these stem cells only from healthy teeth, not teeth which are infected or decayed, from milk teeth. Now, which milk teeth? Milk teeth which have got grade 1 mobility, not those which are flapping and moving around. No, because the pulp tissue is already dead in those teeth. You need to have healthy pulp tissue. So when they've just started moving, when you visit the dentist, they will tell you, oh, you can actually save your dental stem cells with this tooth. We can take it off. Even if it was going to fall off in another month or so, we take it off now and make use of that. Then you have, when for extractions, sometimes you have braces and there's too much of crowding. So you need to remove a few premolar adult teeth. Now, instead of those teeth going to waste, the pulp tissue from here will be very useful for your dental stem cells. So the premolars can be used. And for young adults who are less than 25 years of age, the wisdom teeth, sometimes you need to deliver a wisdom tooth because it's giving you trouble, not the decayed ones, but the ones which are erupting in a wrong position. The dental stem cells from there can be used. What are they used for? For different kind of neural disorders, Parkinson's for one, dementia, Alzheimer's, and these can be stored for years, for many, many years, and you can use it for yourself as well as with your family through those HLA matchings, right? So this is a little bit about dental stem cells. So when you have already stored cord blood cells, do I need to store dental stem cells? The choice is yours. The more, the better. But if you have definitely missed the cord blood banking, dental stem cells will help. Yeah. This is a little display about our clinic and how we had, we love our children. We've actually, for Children's Day, we had a dental carnival where we enjoyed having about 100 kids with us through the week. It was an enjoyable time for us. And if anyone has any queries or needs to connect with us, you can connect with me on these numbers available and with ReeLabs on the information that is given. I hope this particular talk was of use to you all. And if you all have any questions, you can always ask me and I'll be more than happy to answer.
Thank you so much, Dr. Vijaya. This was an extremely insightful session. I personally enjoyed it a lot, and I'm sure everyone else did so. We have been receiving questions on our community, which I have ready for you. The ones who are attending now, please feel free to write your questions in the chat box. Dr. Vijaya's contact details will also be updated in the chat box now. So while we wait for people to ask their questions in the chat box, can I start with asking the questions we've received on the community?
Yes, please.
Okay, so the first question that we have received is regarding iron drop supplementation. It seems to be causing discoloration in certain babies. And how do you, suggest parents can counter that, because they are important as well?
Yes, of course. Iron drops are very important, especially if they are recommended by the pediatrician. Now, they're superficial stains. They are not intrinsic stains. So when you brush well, especially if you use a battery operated, or once in a way, if you come to the dentist, we'll just polish it off and they go off. So you don't really have to worry. Now, second is, if you want to reduce the amount of stains, when you're giving the iron drops, after that, give a little water. Let it not just linger in the mouth. These stains come in because it keeps lingering in the mouth. Yeah. So when you're talking about this, there is one more thing I wanted to bring about, not that I have an issue, but homeopathy sometimes has got sugar, those pills. So you have to be a little careful. Don't give it last thing in the night when the child has to go to sleep. Try to give it at least an hour before, because many a times after you take the homeopathic pills, you cannot drink water. So you take the pills, but make sure the child doesn't fall off to sleep immediately. So that way, at least with the saliva, naturally it gets washed away from the mouth.
Thank you, Dr. Vijaya. Secondly, another question that we have is that when should I schedule my baby's first dental visit?
Okay, so now the first dental visit is before 2 years of age. So around 2 years of age. First, if the child is fine with coming to the dentist when they're 1 year of age, is good. But sometimes parents are a little protective. I would recommend 1 year. 2 years is also fine. If you haven't visited the dentist at 2, you have to visit the dentist. But if the child is comfortable, parent is comfortable bringing the child at 1 year of age, it's perfectly fine. We'll just be playing with the baby, checking the mouth, not really doing much. But it's a good idea to check what is happening in the mouth, and if there is any anomaly, attending to it.
Thank you,
So
doctor.
ideally, if you want to go by a benchmark, it is when the first tooth arrives. Okay, so by
Right.
around 1 year of age is a good time.
Right. There is a question in the chat box by Suhani. My gums got sensitive during pregnancy and they still bleed sometimes when I brush. Sometimes they just bleed when I'm eating or randomly sitting. Does pregnancy affect dental health? What do I do now as I've already delivered, but the gums haven't seemed to improve?
Yeah. So one important thing is that if you haven't visited your dentist, please do that because they will do one round of scaling for you. So that scaling will eliminate all the plaque which is there and the bleeding will come down drastically. One. Second thing, take warm salt water gargles at home and just rinse your mouth. This will actually tighten up that, free gingiva which is around your tooth and help. But I recommend visit the dentist once. Very important.
Thank you.
You can also use, you can also use something called as a mouthwash, the chlorhexidine mouthwash. There are different brands which are available. I can also prescribe the brands if you want. That will also help in reducing the bacterial content. See, basically, there must have been some kind of hormonal changes and plaque buildup, because of which the gums are bleeding. So if you use this particular mouthwash along with warm salt water gargles, it will help. But visiting a dentist is important.
Thank you. And I think the other question she has is,
So
please
I'll just
check the
type it down.
mouthwash brand.
Yeah, so it's called Hexy Dale, Hexidine, Chlorhex, Plaques. So I'll just write it down for you.
Can I take the next question, doctor?
Yeah.
So we have a Janvi who wants to know, my baby is 5 months old and has a habit of putting his fingers most of the time. I assume in the mouth. Is it a sign of teething or is he just exploring his body?
Yes, it is it's both actually. So it is a sign of teething. Many a times if you invert his lip and you see, you can actually feel the gum pads over there. If you feel that there's something bulbous over there, or you see that there is a little bit of a hue, that shows that the child is teething. When the child is teething, they want to keep putting things in their mouth. Just make sure that their hands are clean. At least keep wiping their hands with, clean gauze or so. And also it's a sign of reassurance. So the child is growing so fast, exploring new things, so they want to put their hand in. So that's how they're also exploring the body, comforting themselves. Yeah.
So basically, it doesn't really need to be stopped. It's a normal developmental thing
No,
that.
you don't need to stop. In fact, even when suppose a child is sucking their thumb,
Yeah.
it's normal to suck your thumb till your child is about 2-3 years of age. We don't have to worry. Then after that, if the dentist feels that no, it is affecting the growth of the jaw, the shape of the palate, the proclination of the teeth, the dentist will tell you now it is time that you need to stop this habit. Otherwise, it is perfectly normal if a child is sucking their thumb. It is actually reassuring and it keeps patent the airways, so
Yeah.
that they don't have other issues. Because
Because there's so much misinformation that mothers are so paranoid, because we keep getting queries on the group all the time that my baby is mouthing at 5 months, which is actually so normal, and they're so worried that it'll develop into thumb sucking, the teeth are going to get spoiled, the jaw is going to get malformed, and we have
no,
to keep reassuring them. And I'm glad you're here as an expert to tell them that this is a normal developmental
it's a
process.
normal development. You shouldn't stop these processes because the body, see, when the child is small, they will do things as a reflex. So whatever the body needs, the child will do with its own self. So if we are going to keep stopping and pulling that thumb out of that mouth, it's not going to help. In fact, you're doing a disservice to the child. Yeah, just make sure that whatever they're putting in their mouth, it has to be clean, because you don't want infections. You don't want a stomach bug coming up with that. But like I said, till 2-3 years of age, you don't have to worry about these. After that, when you're visiting the dentist regularly, they'll tell you, okay, this is fine till 5 years. Also, if they suck their thumb, it's okay. Some children, we have to intervene and tell the parent, no, 3 years of age, now I'm seeing some kind of a developmental anomaly. I want you to stop this. This is what you need to do to stop it. The dentist will also recommend, because the parent doesn't know what to do. Right?
Right, doctor. Thank you so much. We have Bhavna Singh who wants to know, can we use teether and what to use for gum before teeth come for 6, 7 month baby? So basically what to use for a 6, 7 month old baby um, as a teether or before the teeth.
As a teether. So best thing, like I said, the most natural you go, the more natural you go, the better it is. So your carrot sticks, which are cleaned, you kind of scale them off, wash them and all. Give that cool carrot sticks to chew on, and cucumber to chew on. That's the best. But you have to be there. I don't want the child, because gum pads can be very sharp. So many a times they'll nick off a little bit. I don't want the child unnecessarily ingesting. If you don't want to give that, then you can give a teether. Those teethers which have the gels are also fine, but you have to keep changing them, because you don't want an old teether where the gel is oozing out. Yeah. So
Thank
you,
you.
either ways, if you're giving the teether, make sure that there is some kind of supervision, whether it is a natural fruit or whether it is just a teether. Yeah.
Right. Arjun wants to know, can we use a toothpaste for a 20-month-old baby? If yes, how much of it should be used?
Rice amount. The amount, the size of a rice grain, that is the size of a non-fluoridated toothpaste that you can use. You have different brands, Pigeon, Chico, there's so many brands which are non-fluoridated, which have to be used. And that size, that can be used. And many a times when, so when you have teeth, you have to brush the teeth. Okay. If you have no teeth, in terms of the children when they are small, less than 1 year of age, and they don't have teeth, you don't need to brush their teeth. You can just, put in those finger brushes, or you can just wipe their gum pads, let them chew on things, and that itself is massaging and cleaning the gums in the process. But when you have teeth, 20-month baby will have mostly all their teeth in their mouth, right? You have to brush their teeth. And sometimes parents have a problem, as to how do I brush? The child is just not opening their mouth. What do I do? So the dentist will show you the technique. Every time a child visits the dentist recommends different brushing techniques which work at different ages, so that will help. And
Thank you.
like I said, even if you don't use a toothpaste, it's fine. You just need to keep those teeth clean. Toothpaste is only a foaming agent. It's just for you to feel fresh. So the child feels nice that they're using something.
Thanks, doc. Thank you, doctor. So we have Harshita who wants to know, my child was born it was a 7-month-old delivery, and it developed first two teeth at age 1. Even now at age 1.5, he has 2 teeth. Is this okay? As new teeth have not erupted. I'll just combine this with another question that we get, that there are babies who are 14 and 16 months who have yet to get their first eruption. What are your suggestions on how to handle that?
So patience. You have to just have patience. Have you ever seen children without teeth? No, it'll all erupt. Some have delayed eruption, some have early onset of eruption. Just be patient. By the time the child is 2.5, all the teeth will be there. Don't worry. In fact, it's nicer, because then you don't have to worry about taking care of those teeth. So the more delayed the eruption, the easier it is on the parent. So don't worry, your child will have the teeth. If for some reason now you say if the baby is premature, usually it does not affect the dentition. That is the last thing which gets dentition. So don't worry, the dentist will have a look and check and see. Many a times there are some children who congenitally have certain teeth missing. This I'm talking about older age. I'm not talking about when they're 2.5, they will get their teeth. But there are some children who have congenitally certain teeth which are missing, tooth buds which are missing. That time the dentist will take the x-ray. They will tell you what to do, how to manage that situation. Science has developed so much that there is a solution for all dental ailments, which is very good. So don't worry, your baby is going to have their teeth. And even if your baby is premature, the baby will have teeth eruption. That just wait, because baby has been premature, eruption will be a little delayed. Don't worry about it.
Thank you, doctor. We have MPS who has messaged that my baby is showing symptoms of first tooth coming. Any precautions for the same?
No precautions, just help them massage their gum pads. So you keep it clean, let them chew, let them, they will feel irritable at times. Like I said, it's some temper tantrums which will be there. Nothing much that you need to do. Give them food. They might have certain issues where they may not want to eat, especially when the gum is cutting through the tooth is cutting through the gum. Give them soft food, give them food which, does not have even a hint of spice or anything in it. Nothing which is pungent, or even if I would say sour, they can use that.
We have a question that has come on the group while the webinar is happening, asking that what is the age you recommend bottle feeding to be stopped?
1 year of age. Wean off the child off the bottle by 1. And how do you do it? That is also a process, because it's so difficult for parents to give in to their children, and children are very smart. They know how to wrap their parent around their finger. So, you'll have to tell them, oh, this is the bottle, it's gone off, it's fallen now, where's the bottle? It's not there. So graduate from a bottle to a sippy cup or just a cup and spoon. Yeah, very important. And sometimes, the other, like another member of the house, sometimes a mama is stuck with the baby. They're like, I can't put the baby off to sleep unless the baby nurses. What am I going to do? So then the daddy comes in the picture, or the grandparent comes in the picture, where the child will be with somebody and not with mama, because the children can smell the milk, and that's when they want that comfort feed. So these few things you have to tweak, and you'll get your way through. Now, another question that was about the gum pads. Like I said, you have these gels which have a little chamomile. I think there is one brand called as Chico, which has chamomile in its gel. That can be used if you want. Otherwise, I would recommend don't use anything as much as possible.
Is this for Bhavna Singh's thing? Where can we give some homeopathic medicine during teething? Suggest any gel or gum for soothing.
So gel is what I'm recommending, which is that chamomile. I usually, if a patient says that a child is very irritable and it's inflamed, it kind of calms it down, because it just has chamomile. Okay. Homeopathy, I don't know much about. So I am not an authority on that. But there are some drugs which are working, which, a very senior homeopath has been giving to their patients, and you can use that. But if you ask me, it is a phase in life. They will just go through this and out. But if that homeopathy is working, very well. I truly do not recommend on my own. I feel that let the child tooth cut through the gum and it'll ease out. I have not given it to any of my children, both my kids.
Right. Thank you so much, Dr. Vijaya. You have been able to really help with all the questions that have been constantly asked, because most of the moms have very similar questions, which we have been accumulating for the past several months. And this session is going to be so helpful. There are some mothers who've been unable to attend, so we've recorded it for them. We'll be sharing it with them. And I'm sure all of them are truly grateful for all your help. And to all the participants here, Dr. Vijaya's details are there in the chat box. We will be putting it on the various WhatsApp groups as well. Feel free to connect with her, seek an appointment, should you need any more information on any of these topics. Thank you so much, Dr. Vijaya, once again for your valuable time.
Welcome. And thank you so much.
Yeah, thank you. And thank you to all the participants for attending our Saturday webinars and making it so successful. Thank you, everyone. See you next Saturday. Bye-bye.
Thank you. Bye-bye.